Muy buenos días a todas y a todos. Gracias por uniros a este nuevo webinar que vamos a arrancar en unos minutitos. Y bueno, quería daros la bienvenida antes de todo y que pase la palabra a mi compañero. Os doy un tip logístico por temas de interpretación. Para que podamos seguir todos el webinar desde el principio. Y es que, como os digo, hay interpretación simultánea de inglés, español, español, inglés, y la podéis activar abajo en la barra de herramientas, en la bolita que pone interpretación. Pues sin más, os quiero dar la bienvenida. Como os decía al principio, es el segundo webinar de una serie de webinars que estamos celebrando en el marco de nuestros proyectos de innovación social, de derechos a la vivienda y de Hay Futuro, Vivienda y HOGAR sí, y con el fin de, ahora que nos estamos acercando al final del desarrollo de los mismos, el transferir y compartir parte de la experiencia que hemos ido generando en estos últimos años. Quiero comentaros que tuvimos el primero focalizado en las cuestiones de Housing First para jóvenes. Una vez que terminemos este webinar, estarán ambas grabaciones en la escuela Housing, que luego os pasaremos el enlace, es otra de las iniciativas que estamos desarrollando para conseguir esa transferencia y esa puesta en común de los conocimientos. Y os adelanto que estamos trabajando para hacer un tercer evento, un tercer webinar a la vuelta de verano. Os iremos informando para que podáis uniros también en esa experiencia. Creo que me queda agradecer, que luego lo haremos, a todas las personas ponentes, que tenemos un panel muy, muy, muy completo, y darles la bienvenida especialmente a ellas, porque, bueno, luego cuando las vayamos presentando veréis que hay en concreto alguna persona que ha hecho grandes esfuerzos por estar aquí con cuestiones de diferencia horaria. Y el resto, bueno, pues efectivamente, pues esos huequitos en agenda que no son nada fáciles. Con lo cual no quiero quitar más tiempo de compartir contenidos, que es realmente lo interesante. Y sin más, paso la palabra a Ernesto. Muchísimas gracias por vuestra participación.
Muchísimas gracias, Vanessa. Por mi parte, igualmente agradecer mucho la participación, ¿no? Y la asistencia de todas las personas que estáis conectadas, tanto por la parte de panelistas y ponentes como de asistentes. Simplemente también dar un par de orientaciones muy brevemente logísticas, ¿no? Como ya ha dicho Vanessa, el webinar tiene interpretación simultánea, que podéis encontrar en la parte inferior en el símbolo del globo terráqueo para seleccionar el idioma que preferéis, sea inglés, castellano o el audio original. Comentar también que durante el webinar se pueden hacer preguntas para que posteriormente traslademos a las personas ponentes. Entonces, para hacer las preguntas, simplemente podéis ir abajo y veréis que hay un pequeño icono que pone caja de preguntas y respuestas. A través de ese icono podéis lanzar las preguntas que tengáis, las iremos recogiendo y en la parte final del webinar destinaremos unos minutos, 10 minutos más o menos, a trasladárselas a los ponentes y bueno, pues generar un poco ese debate y que desde el público podáis también, ¿no?, participar y tener ese espacio para consultas. Igualmente, sabéis que el chat está activo, ¿no? En este caso, el chat simplemente lo podéis usar, bueno, pues para hacer cualquier otro comentario que queráis sobre la sesión, pero bueno, simplemente comentar que en el caso de que sean preguntas, las tenemos que recoger a través de la caja de preguntas y respuestas para poder identificarlas fácilmente. Hasta aquí con las cuestiones logísticas. Muchas gracias a todos y todas, como digo. Y sin más voy a dar paso para que haga la bienvenida o la presentación institucional a Freg Spinevig, director de FEANSA, que está aquí para acompañarnos. Hello, Freg.
Hi, I hope you all hear me. Good morning, good afternoon to everybody. I'm talking from Belgium, sunny Belgium, surprisingly warm today. So, but thanks for the invitation and thanks for letting me speak for a moment. I'm the director of FEANSA, and FEANSA is a European NGO. Probably most of you know us, a European NGO that works exclusively on the issue of homelessness. Our members are organizations working with homeless people in almost all of the EU member states and beyond. And I have the honor to say a few introductory words. And let me start by saying that the two projects that we're discussing here, Derechos a la Vivienda and High Futuro, are impressive projects. They're great projects, not only because of the content they address, the innovation they try to achieve, but also in the way they use EU money to fund them. And I can tell you that there's a lot of jealous people in other countries, and they look at Spain and they want to learn from you on how you have been able to access this EU money for the homeless cause, which is not a simple thing to do. So congratulations for that. And I'm actually looking forward to hear about the results. I would like to make two comments, two reflections about housing first and rapid rehousing, and then early intervention. On housing first, I think we can say that in a European context, also in Spain, housing first is taking off. There's a lot of talk about housing first, plenty of experiments. Some countries are basically scaling up housing first at the moment. I think we have to be a little bit careful because in some countries there's more talk than action. But I think all in all, we can say that housing first is a topic of interest in almost all European countries. And what happens in Spain is probably interesting. I think Spain is a little bit more advanced, probably a little bit more innovative and courageous when it comes to housing first. So many people look at what's happening in Spain. I think it's important for us to make a difference between housing first and rapid rehousing. I think the way it has been developed in the US makes a difference between housing first and rapid rehousing in terms of the target group, with rapid rehousing mostly focused on people with less complex needs, where the focus on housing and the time-limited intervention makes sense. But I think in a European context, it's not always that easy to make the difference, because in the US, people with complex needs are people that are usually long-term homeless. But we see in some countries in Europe that even people that are short-term homeless have complex needs. And so the question is, what do you do with this target group? Do you offer housing first or rapid rehousing? The link between chronicity and complexity of homelessness is not always that straightforward. So I think when we talk about rapid rehousing, and that's why the project in Spain is so important, when we talk about rapid rehousing, we have to still decide in the European context, what place does it have? How does it complement housing first? And for who is it aimed? Who do we target with rapid rehousing especially? And I'm quite keen to hear the speakers later on to see how they see the difference. So that's my first comment on rapid rehousing. The second on early intervention. I think also there we can do with some conceptual hygiene to better understand what we mean by early intervention. But I guess that it relates to the prevention of homelessness. And I think I'm not lying, or I'm not saying something new when I say that prevention, that the knowledge base for prevention is relatively weak, that there is still quite a lot of work that we need to do to better understand what precise intervention works. There's a lot of assumptions that we work with in Europe when it comes to prevention. Like, for instance, that social housing or more social housing will inevitably and directly lead to less homelessness, which is not the case. Of course, we need more social housing also in Spain, but if it is not targeted and reserved for homeless people, it will not necessarily lead to a reduction in homelessness. So I think in prevention in the European context, we're probably a little bit spoiled with our social welfare system, and we're confusing the functioning of our social welfare system with targeted prevention for homeless people. So there is need for a stronger knowledge base, and probably also a need for experimentation there. And that's why this project is so useful. I think we can work in relation to experimentations on early interventions with obvious actors, like organizations that run institutions like prison, psychiatry, youth care, because we know that they produce homelessness, that there is a pathways from these institutions into homelessness. But I think we should also try to work more with atypical actors, like schools, for instance. We know that schools can play a very important role in the early detection of homelessness or imminent homelessness, the health sector, for instance. And I think there we can learn quite a lot from what's happening in the United States. So that's my two small reflections to start off the webinar, and I pass on to the next speaker. Thank you for listening.
Thank you very much, Frank. I think for a short intervention, it was actually really really interesting. I think there are a couple of things that will probably be addressed in the next by the next panelists. This difference between rapid rehousing, housing first, or other modes of intervention. I think it's something that it's very important. Who are they addressed to? With what are the target groups? And also, this definition, no, that it's maybe not always clear of early intervention, its relation to prevention, and also, this participation of different actors, and as you call them, atypical actors, no, right? Like schools, the health system, or other different systems. So I think there you gave some messages that can be probably answered by the next panelist. And well, just say that we appreciate very much your participation today. A continuación, para el primer bloque de intervenciones, vamos a contar con Gonzalo Caro, que es coordinador de Relaciones Institucionales de HOGAR y miembro del Comité de Dirección de Derechos a la Vivienda. Y bueno, no sé, Gonzalo, si quieres ir abriendo tu cámara, nos va a hablar sobre a presentar, ¿no?, cuál ha sido la experiencia hasta el momento del proyecto piloto de Derechos a la Vivienda, qué resultados está teniendo y algunos de los aprendizajes que se pueden extraer en términos de políticas públicas. Te cedo la palabra ya, Gonzalo.
Bueno, lo primero, buenos días, buenas tardes y buenas noches a todas las personas que nos estáis acompañando, y un agradecimiento especial a Freek, que se pierde ese día soleado en Bruselas, que no es fácil, y a las siguientes panelistas que nos van a acompañar, que sé que algunas han hecho un esfuerzo importante. Voy a intentar compartir mi presentación, espero que la podáis ver. Una presentación en la que tenemos buena parte de la información sobre el proyecto. No sé, Ernesto, si me puedes confirmar que se ve.
Sí, la podemos ver correctamente, sí.
Perfecto. Pues la he titulado Atención temprana y Rapid Rehousing, y va a intentar dar respuesta a algunas de las cuestiones que ha planteado Freek. En principio, contextualizar el proyecto de Derechos a la Vivienda, del que, como Freek ha comentado, soy parte de su equipo de dirección. Es un proyecto que está muy orientado a la transformación del sistema de atención al sinhogarismo y poner fin a la institucionalización. Es importante hablar de esta cuestión de la institucionalización como un fenómeno que es capaz de alguna manera modificar las habilidades, la percepción del futuro y de la vida de las personas que son atendidas por distintos sistemas de atención. Es algo que ha estado muy estudiado en el ámbito quizás de la psiquiatría, del mundo penitenciario, y es algo que no se había tenido quizás tan en cuenta a la hora de hablar del sinhogarismo, pero seguro, y como veremos un poco más adelante, podremos estar probablemente de acuerdo las personas que estamos aquí conectadas, de que el sistema de atención al sinhogarismo y la experiencia de sinhogarismo también genera institucionalización. Es un proyecto que ha contado con la participación de 12 administraciones públicas, 8 administraciones locales y 4 administraciones regionales. que está financiado por el Ministerio de Derechos Sociales y Agenda 2030 y, como ha dicho Frek, a través de fondos europeos Next Generation, y que tiene dos líneas de actuación, una de desinstitucionalización, que como os avanzaba Vanessa, tendremos un webinar específico en septiembre, y este de atención temprana y una de atención temprana y rapid rehousing, que es la que hoy nos ocupa. ¿Por qué nació la idea de trabajar la atención temprana? Pues a través de una serie de cuestiones que veníamos observando. Lo primero es que el problema del sinhogarismo venía creciendo. En los últimos 10 años en España había crecido un 25%. En Europa también, según datos de la propia FEANSA y de ABPIER, veíamos que había pasado de 600.000 personas a 895.000 en la Unión Europea. Veíamos también que es un problema que se cronifica. El 68, casi el 69% de las personas en España lleva más de un año en situación de sinhogarismo y el 42,6% lleva 3 o más años. Observábamos una tendencia, y es que los datos nos hablaban de que a mayor duración de la situación de sinhogarismo, peores consecuencias para las personas y mayor institucionalización. Entre las consecuencias, nada que probablemente os sorprenda a las personas que estáis aquí con nosotros y con nosotras: deterioro de la salud física y mental, pérdida de capital social, dificultades en la empleabilidad, victimización por delitos de odio motivados por aporofobia. Y esto nos llevaba a una intuición, y la intuición es que cuanto antes se interviene, mejores posibilidades para resolver la situación. Es decir, antes somos capaces de desplegar la intervención y resolver la situación del sinhogarismo, antes conseguiríamos mejores resultados y con menor esfuerzo. Y teníamos una certeza, y era que haciendo lo mismo íbamos a obtener los mismos resultados, y por lo tanto era necesario innovar y desarrollar este tipo de herramientas. ¿Cuáles son las principales características? La verdad es que los organizadores del webinar me han puesto un gran reto, porque tengo solo 20 minutos para explicaros una experiencia en la que llevamos trabajando ya casi 2 años, y por lo tanto, perdonadme si solo son unas pinceladas. La atención temprana y la prevención de la institucionalización, como os decía, es una de las principales oportunidades para que podamos resolver el sinhogarismo. Es una de las principales oportunidades porque, al menos en el contexto español, era algo nuevo que no veníamos trabajando de una manera muy sistemática. La experiencia de atención temprana de derechos a la vivienda ha supuesto atender a 280 personas, y 60 de ellas han probado una modalidad que trasciende el ámbito de este webinar. Quizás podamos organizar algo en el futuro, que es testar una metodología de apoyos autodirigidos por las personas. La línea de trabajo se focalizaba en personas que llevaban, o pretendía focalizarse en personas que llevan 6 meses o menos en situación de sinhogarismo. Luego veremos que había algunos matices, y tenía un objetivo principal, y es que las personas salieran rápidamente del sistema de atención. Ni albergues, pero tampoco viviendas tuteladas o gestionadas por entidades del tercer sector, sino vivienda en comunidad que las personas buscaban por sí mismos o por sí mismas. De hecho, y me adelanto a los aprendizajes, un hallazgo fue que en algunos lugares que desarrollamos el proyecto teníamos una cosa que llamábamos viviendas de transición, unas viviendas donde las personas pasaban quizás del albergue a esta vivienda de transición, y la vivienda de transición a esta opción elegida por ellos y por ellas en la comunidad. Y uno de los hallazgos es que esas viviendas de transición, lejos de ayudar en los procesos, los dificultaban. Y por lo tanto, nuestro programa se basa en que rápidamente las personas salgan de los recursos típicamente gestionados por el sistema de atención al sinhogarismo. Incluso las viviendas que gestionamos las entidades del tercer sector o las ONGs, incluso aquellas que se puedan gestionar bajo las metodologías que consideramos y seguimos considerando más que promocionan más la autonomía de las personas. ¿Y cómo funciona esta cuestión? Las personas reciben apoyos económicos para sus gastos, un acompañamiento socioeducativo y también un acompañamiento en el ámbito de la vivienda. y son impulsadas desde el primer momento a trabajar desde sus fortalezas. No nos interesa lo que les falta a las personas, nos importa lo que las personas tienen y todas las personas tienen para resolver su situación. Y otra cuestión muy importante, la activación de su capital social. Las personas tienen redes que les permiten mejorar su situación y llegar hacia un objetivo y llegar al objetivo que se plantea desde el primer momento. El objetivo es salir del programa hacia una vida autónoma. Queríamos contaros brevísimamente el perfil de las personas atendidas y algunos de los principales resultados. Lo primero, este proyecto ha contado con un grupo experimental y un grupo control, por lo tanto, la evaluación nos permite tener o nos permite orientarnos hacia una cierta certeza de que los resultados que obtenemos son fruto de la intervención y no de otros factores. Nos encontramos, y de hecho muy parecido al perfil que existe en España, que las personas que atendemos tienen fundamentalmente nacionalidad extranjera, las personas que menos tiempo llevan en esta situación. Y respecto a su trayectoria, recordad que habíamos dicho que buscábamos personas que llevaran 6 meses o menos en esta situación, y nos encontramos que las trayectorias de sinhogarismo de las personas son un poco más altas al evaluarlas. Aquí, una de las cosas que hemos detectado en la evaluación es que estas personas llevaban 6 meses o menos en su última experiencia de sinhogarismo, pero que para estas personas el sinhogarismo había sido una experiencia a veces de entrada y de salida. También, ahora que no nos ve nadie y no nos escucha nadie, pues bueno, hubo alguna persona que en sus propias estrategias de búsqueda vital, pues quizás no facilitó toda la información. Pero en general, la mayor parte de las personas que tienen estos 6 meses que tienen más tiempo de trayectoria tiene que ver con entradas y salidas del sistema. Lo cual es una cosa también necesario para que hablemos, reflexionemos y pensemos cómo podemos impedir estas entradas y salidas o al menos prevenirlas. ¿Qué sucedió en los 7 primeros meses de intervención? Pues nos encontramos con una serie de cuestiones, que las soluciones rápidas y autogestionadas generaban satisfacción en las personas, que la manera en la que trabajábamos, fuera de ofrecer lo que viviendas gestionadas por las 2 organizaciones que lideramos este proyecto, incrementaba significativamente la capacidad de elección. Dónde quiero vivir, con quién quiero vivir, de qué manera la vivienda. Es verdad, todo dentro de las posibilidades o del principio de realidad que impone un proyecto de este tipo. Mejoraba la autonomía de las personas, su autoconfianza y la motivación. La evaluación a los 7 meses también nos decía que estos apoyos flexibles, basados en las fortalezas de las personas, en la activación de su capital social, eran idóneos y favorecían la perspectiva de la desinstitucionalización. Esta idea de que las personas mantengan sus habilidades y su visión del mundo de acuerdo a digamos, a lo mismo que opera para cualquier persona de las que estamos aquí y no de acuerdo a las normas de un centro o de una organización. Observábamos que mejoraba la salud y el bienestar emocional. Observábamos que mejoraba, pero quizás requería más tiempo el hecho de recuperar lazos con amistades y familiares, y encontrábamos un resultado muy interesante en el caso de las mujeres, que era que se producía muchas veces la ruptura con las parejas que habían tenido durante su situación de sinhogarismo. Esto para nosotros es un resultado muy importante porque significa que las personas, en este caso las mujeres, también eligen con quién tienen sus relaciones afectivas y no se ven mediatizadas por otras necesidades, como por ejemplo la necesidad de seguridad. Las personas activaban herramientas, sobre todo para la activación laboral. Las personas mejoraban sus perspectivas de encontrar empleo, no siempre un empleo en la economía formal, también hay que decirlo, y mejoraba el optimismo de estas personas. Y esto se traducía en una cosa que hemos denominado las salidas autónomas, de las que luego hablaré un poco, pero básicamente las salidas autónomas son aquellas salidas que son decididas por las personas y que además de decidirlas las personas cuentan con unos recursos suficientes y con una serie de circunstancias y características que las hacen sostenibles en el tiempo. 2 cuestiones de los resultados. Aquí vemos la distribución de dónde pernoctaban la noche anterior las personas que participaban en el proyecto, grupo experimental, y las personas que no participaban en el proyecto, que es el grupo control. vemos que al comienzo las distribuciones son muy similares respecto a la pernocta en espacios públicos, albergues y alojamientos de fortuna, y sin embargo vemos que el grupo experimental, la inmensa mayoría de las personas a los 7 meses se encuentran en una solución con un enfoque de vivienda, es decir, en nuestro proyecto, y vemos que del grupo control también mejora en las soluciones con un enfoque de vivienda, pero mejora menos que el grupo experimental. Y también encontramos, como os decía, la idea de que las personas encuentran empleo. Vemos un impacto positivo de 3 puntos. Es verdad que el grupo control tenía una mejor perspectiva de empleo al comienzo y su mejora, aunque también se produce una cierta mejora, es menor que en el caso de las personas que han sido atendidas por nuestro proyecto de atención temprana y rapid rehousing. Y aquí los resultados de salidas autónomas. Estos son datos de junio, porque todavía no hemos contabilizado los datos de julio. Y aquí veíamos que ya en junio 83 personas habían salido de manera autónoma, es decir, 83 personas han construido su proyecto vital fuera de nuestra atención, valiéndose de los medios que han sido capaces de movilizar y también de los recursos existentes en la comunidad, y que en junio 68 personas tenían prevista su salida autónoma. Esto significa que el 73% de aquellas personas que han sido atendidas por nuestra línea pura de rapid rehousing han logrado su salida. Y apoyos autodirigidos, que como os comentaba, forma parte de esta idea de la atención temprana. En junio 40 personas habían logrado su salida de forma autónoma, 14 personas la tenían preparada, y esto significaba un 90% de personas que en aproximadamente 15 meses de intervención han logrado resolver su situación de sinhogarismo, y ya a día de hoy no significa que no necesiten apoyos, pero ya no requieren apoyos del sistema de atención al sinhogarismo. ¿Qué aprendizajes hemos sacado? Lo primero es que nuestra intuición no fallaba. Observamos que por norma general, aunque luego a veces en casos particulares se desarrollan ciertas casuísticas, cuanto más temprano se interviene, más fácil se resuelve el problema. Menos esfuerzos necesita el sistema, pero también las propias personas, porque menos problemáticas avanzan. Otro aprendizaje tiene que ver con el perímetro que hay que definir del sistema de atención del sinhogarismo. Y por lo menos desde Hogar y Vivienda tenemos claro que el foco de nuestros proyectos o de nuestro papel es resolver el sinhogarismo, que las personas van a tener algunas problemáticas y algunas cuestiones además de su situación de sinhogarismo, y que nuestro foco tiene que ser acompañar a estas personas a resolver su situación de sinhogarismo y conectarla con la comunidad, porque este es el siguiente aprendizaje. La comunidad es clave. Si no podemos resolver todos los problemas de las personas, sí podemos conectar a las personas con la comunidad para que les ayuden a gestionar estas problemáticas y estas circunstancias que probablemente les van a acompañar, o si no toda la vida, la parte de su vida. Pero si hay, por poner un ejemplo, personas con problemas de salud mental que no están en situación de sinhogarismo y que gestionan su salud mental con toda normalidad en sus viviendas y fuera del sistema de atención al sinhogarismo, las personas que a día de hoy están en situación de sinhogarismo pueden perfectamente gestionar desde su propia vivienda y conectados con los servicios comunitarios esas circunstancias de salud mental. Otro aprendizaje es la planificación no ya centrada en la persona, sino liderada por la persona. Las personas, por lo general, somos de fiar, las personas somos responsables y las personas somos capaces. Y el hecho de encontrarnos en algún momento de nuestra vida en una situación de sinhogarismo no hace que dejemos de fiar. Por lo tanto, cuando le otorgamos el liderazgo y el protagonismo a las personas responden. Y por último, que los profesionales también nos transformamos. Estos enfoques requieren que cambiemos, requieren de cambios en las figuras profesionales, requieren que desarrollemos nuevas habilidades, requieren que repensemos formas en las que intervenimos y requieren que incluso nos replanteemos cuál es nuestro lugar en el mundo como personas que en un momento dado de nuestras vidas acompañamos a personas que en un momento dado de sus vidas se encuentran en situación de sinhogarismo. Y ya voy terminando. ¿Qué retos tenemos de aquí al futuro? Pues lo primero, difundir. Os agradecemos muchísimo a todas las personas que hoy estáis aquí, conociendo lo que estamos haciendo, conociendo lo que se hace en otros lugares del mundo, y necesitamos que cuando salgáis de aquí, si os resulta interesante lo que os hemos compartido o cuando estén colgados los vídeos, lo difundáis en vuestros ámbitos de trabajo, porque si este proyecto se queda en una magnífica evaluación que después metemos en un cajón, no sirve de gran cosa. Lo siguiente es convencer, porque aquí he traído unos pequeños datos de evaluación y os aseguro que la evaluación es mucho más completa y muchísimo más trabajada, pero no siempre la evidencia es suficiente para convencer. Y aquí tenemos un trabajo importante de convencer de que es necesario transformar el sistema de atención al sinhogarismo, de convencer de que hay metodologías que son útiles para transformar el sistema de atención al sinhogarismo y de convencer de que vamos a obtener resultados y de que es impepinable hacer esta transformación si no queremos que dentro de 10 años volvamos a hablar de un nuevo aumento del sinhogarismo. Una vez convencer, necesitamos escalar estos proyectos piloto, estas iniciativas y convertirlas en lo que podríamos llamar en mainstream. Convertirlas no en la anécdota, no en una iniciativa que alabamos en un webinar y que nos fascinamos, sino que sea la cuestión natural. Y por último, transformar. Necesitamos transformar los sistemas de atención al sinhogarismo. Necesitamos en general transformar todos los sistemas de cuidados de larga duración, porque además en este mundo en el que estamos, muy probablemente cada vez nos vamos a encontrar con retos más acuciantes, con necesidades mayores y por lo tanto tenemos el reto de que nuestros sistemas de atención se transformen. Y bueno, solo agradeceros que nos hayáis escuchado, agradeceros haberos conectado y que espero haberme ceñido al tiempo y que seguro que hagáis todas las preguntas que consideréis necesarias. Por favor, si se dirigen a mí, que sean facilitas, pero más allá de la broma, espero que os haya resultado interesante y que podamos tener un buen debate o que por lo menos haya suscitado vuestro interés.
Muchísimas gracias, Gonzalo. Nada, has manejado muy bien los tiempos, por una parte. Te voy a pedir un momentito que antes de que te desconectes voy a lanzarte ya alguna pregunta, porque ya ha caído alguna pregunta en la caja de preguntas y respuestas, aunque tendremos un espacio posteriormente para no dejarla esperando tanto tiempo. Bueno, en primer lugar, simplemente destacar de tu intervención hacer eso, algunos pequeños destacados, ¿no? De cosas que se han hablado, que también apuntaba Freck, que son importantes, ¿no? En la definición del perfil que habéis hecho de atención dentro de esta línea, ¿no? Que es una definición bastante sencilla, personas que lleven menos de 6 meses en situación de sinhogarismo, ¿no? Y luego yo creo que uno de los grandes destacados de este programa, que es una orientación muy, muy clara hacia la autonomía, ¿no? Hacia la autonomía del sistema de atención al sinhogarismo tradicional, pero también de las propias soluciones, ¿no? más personalizadas, etcétera, que sin embargo se busca evidentemente, ¿no? Que las personas puedan salir de este sistema, ¿no? Y puedan mantenerse pues a través de sus propias capacidades, mecanismos, contactos, etcétera, ¿no? Y bueno, como esto está dando lugar, hasta con los datos que tenemos hasta el momento, ¿no? A una activación muy rápida y una salida de ese sistema de atención bastante rápida. Te traslado dos preguntas por si las puedes responder de forma breve. Una es la que ha entrado. Por una parte, preguntaba una persona cómo encuentran las personas con las que trabajáis vivienda en zonas tensionadas o que hay una ausencia de oferta de alquiler. Bueno, acaba de hecho de entrar una pregunta que está algo relacionada, ¿no? De cómo gestionan el contrato de alquiler las personas, es decir, si hay discriminación, si tienen dificultad en el acceso a este contrato de alquiler. Y luego, bueno, hay un tema también que en conversaciones previas hemos hablado, ¿no? Que tiene que ver en ocasiones un aprendizaje que se ha hecho, que es la dificultad de encontrar a las personas, ¿no? que están en esta situación temprana de sinhogarismo. Entonces, bueno, pues si te parece, te dejo de momento estas dos preguntas para abrir un poco boca y luego ya a lo que vaya entrando responderemos posteriormente en el debate.
Menos mal que os pedía que las preguntas fueran fáciles, ¿eh? Bueno, voy a empezar por la última. La cuestión de cómo encontramos a las personas y de hecho guarda mucha relación con otra cosa que has comentado, Ernesto, que tiene que ver con el perfil. Originalmente, en nuestra hipótesis, porque cuando te diriges a un proyecto de innovación siempre eres quizás muy obstinado y dices, "Buah, esto va a salir". Nuestro perfil original eran personas que llevaran 3 meses o menos en situación de sinhogarismo. ¿Qué nos pasaba? Que no había mecanismos de detección que nos permitieran encontrar a estas personas. Si estaban en el sistema, no éramos capaces de identificarlas y por lo tanto hubo un momento en el que necesitamos ampliar el perfil hasta los 6 meses. Incluso en algún lugar tuvimos que aceptar a algunas personas que llevaban menos de un año. Las menos, pero tuvo que suceder. Y esto es otro de los aprendizajes. Necesitamos mejorar los sistemas de detección tanto que tienen las administraciones públicas como las que manejamos entidades del tercer sector. El otro día teníamos una reunión con administraciones y una reflexión que surgía era, por ejemplo, de qué manera también podemos repensar los equipos de calle en los que se invierten muchísimos recursos y que probablemente ahí haya algo a futuro que tengamos que trabajar porque y en esa manera en la que los equipos de calle incluso se puedan convertir en elementos de conexión con estos servicios de atención temprana y rapid rehousing. Sobre la búsqueda de la vivienda, pues como he comentado, en el equipo tenemos tanto un apoyo socioeducativo como un apoyo de vivienda. Ahí hay un técnico especializado en vivienda, la Asociación Pro Vivienda es experta en estas cuestiones y hace un acompañamiento de las personas para la búsqueda. Aquí otro hallazgo ha sido el tema del alquiler de habitaciones, que además es una cosa que al menos a las personas que se conecten de otro lugar quizás no sea tan candente, pero ahora mismo es un tema importante en la conversación pública sobre la regulación de vivienda. Y aquí hemos encontrado un hallazgo y es que el alquiler de habitaciones es una herramienta útil y valiosa que permite, por un lado, de una manera ágil, acceder a una vivienda en comunidad y de manera autónoma y a un precio más asequible en los mercados tensionados y por otro lado tiene algunos retos de regulación como tiene que ver con la seguridad en la tenencia, las posibilidades de empadronamiento o también retos en la gestión del día a día cotidiano. No obstante, así es como lo hemos resuelto, sobre todo a través de que las personas alquilar una vivienda en comunidad. Y aquí una de las identificaciones es la necesidad, y supongo que Fred estará de acuerdo conmigo y también las compañías de otros lugares, la necesidad del uso de vivienda pública para estos programas. Algunas administraciones han puesto vivienda pública para nuestros programas y de esta manera, pues obviamente estos programas son mucho más fáciles. No sé si he resuelto las dos cuestiones que me planteabas.
Sí, muchas gracias. Has contestado yo creo a las dos vamos, desde luego suficientemente bien y por extenso. Yo creo que de momento hay alguna pregunta más, pero seguramente la vamos a dejar para la parte final. Y bueno, pues nada, simplemente ya agradecerte la intervención, Gonzalo, y hablamos quizás en el debate si surgen algunas cuestiones adicionales. Muy bien, pues a continuación vamos a dar paso, ¿no? Tras esta intervención, esta ponencia un poco más marco, a la segunda parte del webinar de hoy, que lo que buscamos, ¿no? Es tener un panel de discusión, ¿no? Con un carácter internacional sobre experiencias de desarrollo ya de servicios de atención temprana y de rapid rehousing en aquellos países en los que ha habido un mayor avance, ¿no? Digamos, en la puesta en marcha de estos recursos y en su transformación igualmente en políticas públicas. En concreto nos vamos a ceñir a Estados Unidos y Reino Unido. Y bueno, para este panel, si queréis ir activando vuestras cámaras, audios, contamos con Lydia Stassen, que es directora ejecutiva del Institute of Global Homelessness de Estados Unidos. Contamos también con Jessica Kubicki, que es Chief Initiative Officer de The Housing Collective de Estados Unidos igualmente. Y también contamos con Francesca Albanese, que es directora ejecutiva de transformación en las políticas y social de Crisis UK, que viene de Reino Unido. Bueno, bienvenidas a todas. Welcome everyone. Thank you very much for your participation today. I know that especially for you in the USA, it's quite early, so we are really thankful for your assistance today, for your participation today. To begin with this panel, I wanted to make first question to all of you. Maybe, I don't know, maybe Francesca, you can start talking, and then we go to Jessica and Lydia. I wanted to ask, when did rapid rehousing programs and policies begin to be implemented in the UK, and what need they did respond to, and what were the first steps taken to be, I mean, for these policies and services to be considered as a necessary response to homelessness?
Yeah, and hello everybody. Yeah, so in the UK, it's probably worth saying that we have homelessness policy is devolved. So we have different policies in England, Scotland, Wales, and Northern Ireland. So it's just to say that. So when I talk about rapid rehousing and early intervention, I will focus on different countries' responses. So I also wanted to say that we're still definitely on a journey with this. And there are others across Europe and North America who, you know, are more advanced in certain areas from the UK, but I'll certainly sort of start to talk about kind of where I feel we've done really positive things. So I think as Freck was talking about earlier, we have done a lot in the space of housing first. And we have a number of different programs on housing first across each country that makes up the UK, and we started them roughly in 2010. I think one of the things I'm very conscious of, though, is we still, I think, have too much of a project-based approach to housing first. And we don't have it as kind of integrated in our systemic and strategic response to homelessness. We have that more in Scotland. So I think one of the really positive things that we've seen in the last few years is we have a strategy to ending all forms of homelessness in Scotland, and housing first and rapid rehousing is really key to that. And that has involved action at a kind of national and local government level as well. And in terms of what it was in response to, so we have seen rising homelessness across all the UK nations. That is down to a lack of supply of housing, which I think is, you know, that is something felt across everywhere. So genuinely affordable housing. We have lots of people, and still do have lots of people, trapped in expensive temporary accommodation. So the focus on rapid rehousing and housing first is definitely in response to that. But we're still on a journey, and we still have lots of people trapped in temporary accommodation. And I'll just finish on the fact that from Crisis's point of view, so we are a provider of services ourselves, and we campaign for policy change. We have actually started to do two projects which are within this subject area. So we run housing first services, but we've also started to work in two areas with critical time intervention projects, so working out prisons. So we go into prisons up to 3 months before people are due to be released, and we look at how we can prevent people from being discharged onto the street. And that has been a really positive intervention. We're still piloting it. We are doing a randomised control trial at the moment to look at the results. But I would say that, again, that's responding to that targeted prevention need that Freck also talked about. So we know that some people are disproportionately more likely to experience homelessness. And so early intervention and targeted prevention routes, so prison leavers, care leavers, people in the asylum system, as well as people with complex needs through housing first is really, really important.
Thank you, Francesca. Well, you gave a lot of information. I'm gonna just say that something important that I think will connect with Jessica's and Lydia's speeches also. I think how rapid rehousing solutions are connecting with this with this need, with this social problem, that is that there are more people who is getting into homelessness situation, and new profiles of people as well. So bearing this in mind, I would like to ask you, Jessica, the same question. Well, when did rapid rehousing programs and policies begin to be implemented in the USA? And well, what were they responding to?
Absolutely. Good morning, everybody. Again, my name is Jessica Kubicki. I am in the United States on the eastern side of the state. So the federal government started funding rapid rehousing about 2009. Our state implemented it a few years later. So I would say it was kind of between 2012, 2013. So we've had several years of experience utilizing this program. I actually really want to give kudos to Gonzalo and the research that he was talking about. It was really nice to hear about the program and the importance that I think sometimes as you've been in a program for so many years, you forget some of the reasons of just why you do what you do. And that was fascinating. So I think, as others have said, rapid rehousing is an intervention that really genuinely is meant to get people quickly out of homelessness. So while we try not to stigmatize or identify clients that we think could or could not be successful, there are certainly risk factors that we take into consideration when identifying clients for this program. Employment history, even if they're not working, right? So income is not required. But I think those that have a work history are open to engaging in employment because income does become so important to that. So that was one reason I think that we started to implement this program. The other, which I know has already been stated, but I really want to emphasize again, is just that the longer somebody stays in homelessness or a housing crisis, the kind of like increased negative effects that it has, especially on kids, right? But even just our adult population. And so we really, I think, try to focus on as quick as possible outcomes. I know that you all were talking about 6 months homelessness. We, I think, would love for that to be our target as well. Sometimes people are actually homeless a little bit longer when they come into our program. And I would say that we also, I think, we're trying to identify a cohort that didn't need the highest level of intervention, which then would free up those resources for those that were more high need. So that's I'll stop there because I have so many other things to say.
Thank you very much, Jessica. And Lydia, same question. I would like also if you can expand a little bit on that.
Yes, so rapid rehousing was first designed in the United States in 2008, and it was a specific response to the housing crisis the United States was seeing at that time. We had some number of years of predatory mortgage lending. I hope that phrase translates okay into Spanish, but what was happening is banking institutions were looking at really targeting really vulnerable households with extremely expensive mortgages and convincing these vulnerable folks to get into mortgages that they couldn't afford. And so we had a huge number of people newly becoming homeless who did not have the same profile as kind of the chronic homelessness profiles. And so it was designed to give those families, that specific population, families and individuals, a little boost out of the situations that they had been targeted to fall into. And so it was always designed to be temporary support to provide some rental and utility assistance and some case management support, light case management support to those individuals and families to get them back onto solid footing, onto stable ground. And it was really effective at that time for those populations. And so I think our national government and our homeless services sector thought, okay, let's see how we can continue to use this going forward. And I think there's some very interesting things that have happened over the past 10 years, maybe using rapid rehousing for populations that it isn't exactly intended for. And so you see less efficiency of the programs. And so I think even here in the United States, we're still learning more and more about how to use rapid rehousing to achieve the best possible outcomes. And I think Frake in his opening remarks really framed the conversation very well in terms of what is the population that we're trying to serve with this program. And sometimes that's a different population than the population that needs to be served by Housing First. And so I think as we understand the historical context of when and where and how rapid rehousing was developed, I think there's really important lessons for us to reflect on in terms of the population and continuing to evaluate whether we get the housing outcomes we want to see.
Thank you very much, Lydia. No, there is this highlighted idea of different services for different needs, probably, right? Continuing with you also, Lydia, I wanted to ask you a second question. What do you think? I think you advanced some of them, but what do you think are the most important characteristics of these early intervention or rapid rehousing programs that contribute to their success? You already mentioned a little bit about temporary support, like case management support, but if you could expand a little bit more on these key characteristics of the programs.
Yes, so I think somewhat like Housing First, there's a little bit of a difference between the devolved countries of the UK, the United States. We do also see rapid rehousing programs being piloted in Brazil. I think there was also a pilot in the Czech Republic. So I would not say there is 100% consistency across all these different countries that are piloting that. And I think that's okay. I think that we need to be able to make adaptations to the core elements depending on our contexts, our resource bases, our cultures, our language. So I think from my perspective, a critical element is really the timeliness of the intervention. Both Francesca and Jessica mentioned how quickly can we get people from their experience of homelessness into their settled home, into their permanent home, whatever that looks like for them. And that's in the name, rapid rehousing. So I think that's one really critical element. I think selecting your population is a really critical element, and having that case management. You know, it's not only rent or utility assistance, it's not only the housing, but how are we providing additional support to make sure that people make that transition from homelessness into settled housing really well. I think sometimes we get lost in the importance of the services or I think we focus a little too much on the roof and not enough on what it takes to help people sustain that roof over their heads. I will stop there. I think Jessica and Francesca probably have a lot more color they can add to it, but just to recap, I'd say the timeliness of it, the population of it, and then the services and case management component.
Thank you very much. Jessica, if you can.
Yeah, so that's actually perfect. Lydia, I would totally emphasize those. In addition, I think the only other little pieces I would just add is your housing inventory. So I know this was briefly talked about during the initial presentation. I think having a variety of units is really important, and also landlords that are your partners, because they are working with what is deemed a program, right? And so there's a lot of stigma that does come with that. So I guess the big emphasis that I would put is it's not just having a robust number of one-bedroom units, but I think going back to room rentals or studios or shared housing, but having landlords that are comfortable working with the program, open to working with the program. And I think, to Lydia's point, the only way that you can transition someone quickly is you have those units available, right? And so it's kind of building those partnerships ahead of time. The other and last piece that I will just say from our experience we have learned is there has to be an overall belief that the program is successful and can work. We went through several years during COVID mostly where there was a loss of belief that the program works. And I think the staff were exuding it to the population that was going into the program. And so we saw outcomes that reflected that, right? And so I think it is really necessary that it's not just the clients that believe that they can be successful, and going back to that whole autonomy, right? But the staff that are supporting the intervention, and even just the community. There needs to be an emphasis of, I can do this and be very successful, and also graduate, however you want to emphasize this, right? But like successfully graduate from the program and be able to sustain housing myself. I think that we've learned that that is just so important.
Thank you very much, Jessica. You brought also a couple of themes that are very important also, I think, in the Spanish experience, having this availability of different solutions, of different home solutions, so that rapid rehousing can happen on time. And also this thing about the confidence, not only of the person, but also of the communities and the staff who is working with them. So these are very interesting themes. And Francesca, I also would like to ask you the same question about the characteristics and the key characteristics of the programs you have in your experience, thinking mostly in this, this new pilot project you have in working with people in coming out of prison. So I don't know if you want to add a little bit on this.
Yeah, I suppose I wanted to make a bit of a wider systemic point, which is, I think, in order for rapid rehousing and early intervention to work, it's got to be linked to an overall strategy of making sure that homelessness is rare, brief and non-recurrent. And I think, so some of the things that are kind of more programmatic project level, where, you know, there's definitely got to be a belief that it works, and thinking about what the outcomes are and getting people quickly out of the homelessness system. It's got to be linked to a strategy that wants to end homelessness quickly, but also is, I suppose, across different responsibilities, departments, directorates, however you would want to describe those. I know they're called different things in different countries. So when I think about the work we've done in prisons, we really needed the head of the prison and the probation service in those areas to be totally on board, because it actually was a blocker at first. And when I think about other areas where we're trying, so essentially, if you do prevention well, you should have less people needing to go through the homelessness system and be rapidly rehoused, because it's about targeting those groups first. And so there's also, I think, whatever group of people you're thinking about. So we've heard a lot about health. I know that that's something. So we work in partnership with an organisation called Pathway, who are a specialist homeless health charity, and they do rapid work out of hospitals into stable accommodation. And again, you've got to have health around the table. You know, you've got to think about who are the actors, who have the levers, who has the resources in order to make the change happen. And finally, we need housing. And I know that's a very obvious point to make, but I think Fred mentioned it at the beginning. It isn't just about more supply; it's about linking supply to your homelessness strategy. So you can increase supply in an area, but you've got to have some kind of mechanism to make sure that the housing that's being provided is linked to the rapid rehousing solution that you've got, whether that's at a kind of local level or a national level.
Thank you. I think that's a great point, and it's not obvious. It's very good you stated. Well, I mean, these two things you highlight, the systemic approach, aligning our strategy with the support services we have. And also the second one, the importance of alliances, right? Jessica was talking about the alliance with landlords and with housing providers. You also mentioned with other entities or companies working in the field of health, for example. So this is also a really good and really important point. Going a little bit further with this and linking it to more with the policies, I would like to ask you, Francesca, we can start with you this time. how was the process, especially in those places where it is more developed, like Scotland? How was this process for rapid rehousing to be extended and scaled up to become we could say, a widespread policy at the national level? And what do you think are the key elements that lever this, this scaling up?
Yeah, so as I mentioned at the beginning, I would say like we're still, there's still work to do. So for those of you that know the context of the UK, we love legislation. That is our route to bringing in change. So we have, legislation about prevention. We also have, we have legislation around who gets access to resources. So I'd say in terms of what was successful in in Scotland, they abolished what's called priority need in 2012, and so that means that everybody has access to housing. What then happened is we've ended up with a lot of people trapped in temporary accommodation because people get access to the temporary accommodation, but there's no route out of that. So one of the things that the Ending Together Homelessness kind of plan has done in the Scottish context is it required all local authorities to develop what's called rapid rehousing transition plans, where every local authority had to set down in writing like how they were going to shift from the system that they had in place to moving people quickly out of the system. And they're still getting there with that. So we have those transition plans, but they're all in different stages of development. I know the last question's on challenges, so I won't go into that, but we do have some challenges at the moment around kind of what that looks like. And I think the other thing just to say in terms of like, how do you kind of achieve it? I mean, I think there is that thing of like, you need people's buy-in, and we need people to want to succeed. It is possible. I think one of the things we're always battling as a campaigning charity is that idea of fatalism, that homelessness will always exist. So actually a lot of the success is around proving by doing. And I think that's what I would say sometimes the UK lets itself down. I would say that across all countries that we work in crisis, there's a lot of talking sometimes, and we need a bit more action. And so it's kind of showing how do you show in a place-based approach. So I know one of the vanguard areas is Manchester, and that Greater Manchester, and that's really interesting in terms of like the mayor there, Andy Burnham, has really set out what he wants to achieve. And I think so it's definitely that kind of leadership at a national and local level, but you have to have the resources, and you've also got to have an implementation plan as well as the legislation.
Thank you, Francesca. I think that's a very complete view, the resources, the strategy, and the implementation. These three different steps. Jessica, if you want also to tell us a little bit more about the situation in the USA, how this rapid rehousing strategy is also becoming a widespread policy on the national level, and what are the key elements for this to happen?
Absolutely. I'm actually going to, I think Lydia will probably speak a little bit better on the national side. I'll speak about Connecticut and kind of what we've been doing. So I will say that we were not one of the first states to implement this back in, 2008 or 2009, whatever year. I mean, it obviously took us a few years to kind of get it together, at least to like fully widespread implement this. One of the challenges that we actually experience is that our state does not invest in this project in the way that we wish that they did. So our rapid rehousing is primarily federally funded. Just to give some context, the state gives us about $50,000 of rental assistance. We get 1.2 million from the federal government. So it's kind of nothing compared to something. And so we, as a continuum of care, so our kind of network, right? We invested in rapid rehousing. And I think going back to what Francesca said, we had to really, it's all about the mindset again, right? Like going back to the belief that this program works, we had to really get our network of providers to believe that when we're applying for limited funding every year from the federal government, to invest in rapid rehousing instead of what you all refer to as like housing first, right? Like, so permanent housing. And so we slowly did that over probably about 3 to 4 different years. And I think the big emphasis was that all rapid rehousing, at least in the state of Connecticut, and I think kind of nationally, right, the way the funding is set up is very low barrier, meaning you do not have to have inevitably anything to serve a population. So there's no disability requirements, mental health, substance abuse, no income requirements. There's technically no citizenship requirements. So we can serve anybody with this intervention. And that is a really good motivating factor, I think, for our communities, because you're limited otherwise, right? There's certain cohorts of people that can't be served by other interventions. And so this allows us to quickly get them out, and so that they're not just living in this state of homelessness long term, which obviously betters the entire community as a whole. So that's kind of how we did it. And so we have kind of maintained at over $1 million for many years of rental assistance, and continued to invest in obviously the services that go with that.
Thank you very much, Jessica. Lydia, you can give us the picture at national level then.
Yes, I don't know if people intended to receive a United States civics lesson, but this is the track we're going down. But Jessica touched on something that I think is really important, and Francesca had mentioned the 4 devolved nations in the United Kingdom. We have 50 essentially here in the United States. And so every single state can decide more or less how they want to interpret federal policies, federal legislation. So there is a wide disparity amongst all our 50 states on how rapid rehousing gets delivered. I'm in the state of Illinois. I'm based in the state of Illinois, which is known as one of the more progressive states in the United States. And so in 2008, when the Obama administration developed this rapid rehousing response, Illinois was on it. And so our state then supplements the federal dollars with a pretty significant amount of money. So there's a greater pool of these rapid rehousing dollars that can be spent for rent, utilities, and so on. And I think one reason this particular model was embraced at the national level was because we were in an unprecedented crisis at that time. We'd never seen something like that financial crash, at least in recent history. And so in moments of crisis, and I think we saw this globally with the pandemic as well. I think we're beginning to see it with the new waves of migration and with climate change. Crisis gives you opportunity to innovate and to pass something through at a huge level. So that's really what happened in 2008. It was a moment of crisis. We could pass it nationally much more quickly than legislation is usually passed in the United States, and it was effective. They looked at the data, and so I think when we think about scaling programs, when we think about getting national buy-in for these programs, I think we have to continue leading with the data and the evaluation of why this works, why this investment of government money makes so much sense. And we're starting to see pushback globally on housing first because it is a more expensive intervention. Governments don't want to continue to invest that level of resource. And so it's up to us as the sector to get creative with how we present the formula. Do we have the data on how many people are going to need housing first? Do we have the data on how many people are going to need rapid rehousing? Do we have data on how many people need some other type of housing and services combination? And do we have the data that proves those programs are effective? I think that's how you begin to sort of build a case to national governments for investing in particular programs. And it's extremely challenging. I mean, our country is in a very different position than we were in 2008. And so it's much harder now to pass national legislation than it was back in 2008. And so I know here in the United States, a lot of national organizations are beginning to develop 50 different strategies for 50 different states. So it's extremely complicated, but I'm a total optimist. And we do have more, I think, power as a sector than we want to admit. And we need to continue to be telling the stories of change and possibility and using the data to back it up.
Thank you. I think these last three things you mentioned are actually pretty relevant also to the Spanish situation. Cooperation between different levels of the administration. Here we also have a decentralized state, so we face to a certain extent the same challenges in this sense. All this dynamic between crisis and opportunities also, which have been one of the reasons that this program can be implemented as well, and the importance of data in many senses, but also to prove the efficiency and effectiveness of this kind of programs. On my part, I want to make just this last question and then give some space for people in the audience to ask. If you could comment, Lydia, maybe you can start first this time, a little bit briefly about what are the biggest challenges still to be faced.
I will answer this from the United States context, which is our National Department of Housing and Urban Development several years ago really moved away from the idea of transitional housing, because the data was showing the sooner you put people into permanent housing, the better their outcomes on all levels. So they said, we're not doing transitional housing anymore. And then rapid rehousing was introduced. And I think I'm looking at Jessica and she's smiling and nodding. We've seen some communities use rapid rehousing as transitional housing. Just functionally, that's how it's being used. And so that decreases its efficiency, because we do know that whenever people move from home to home, there's an additional likelihood that they're going to return to homelessness. They're going to fall back into homelessness. And so we are seeing some of that with the rapid rehousing models right now. And so some of the evidence is really questioning the efficiency of rapid rehousing. And we have to take a step back as a sector to say, it's not being used the way it was intended. It's being used as transitional, it's being used as temporary housing. And so we need to refocus on the original stated goal. I don't see that same challenge happening in other parts of the world where this is being tested, but I'll be curious, Francesca's opinion on that, because I think in Scotland, they literally talk about how they're transforming their approach to temporary accommodation and transforming it into a rapid rehousing approach. So I think there's a lot that we could learn now as the United States from other countries that have taken something that maybe originated here in the United States, but are using it sort of in a different and more meaningful way that leads to better outcomes for people. So that's one particular challenge that we have here in the US.
Thank you, Lydia. Jessica, if you can comment a little bit, and then we go to Francesca. That was also.
Yeah, of course. So I think on more of the local level, one of the challenges that at least we are experiencing is the very inflated rent and inventory of units in our community. I think we just came out with we're number 5 out of all 50 states of most expensive housing markets kind of compared to the cost of living. Unfortunately, our cost of living did not increase like the 5 times that rent did. And so unfortunately, affordability has become unlike a problem. We've always had challenges, right? We've always been a very expensive part of our state, but it has become quite unattainable. So I think we have actually spent the last probably 6 months, maybe a year or so, really trying to figure out kind of the same questions you all are having now about targeting the right population so that the intervention is actually a standalone intervention. Because one of the things we were finding was people were going into rapid rehousing and just for affordability reasons only, were not going to be successful. And so we were actually tacking on some type of permanent subsidy at the end. And so you end up using double resources for one person, right? And so we weren't maximizing this intervention in the way that it was intended to be, right? Kind of talking about what Lydia was saying. So I think for us, we've been trying to figure out the right cohort so that, again, on the affordable side, we are still targeting and utilizing this intervention to be successful in setting households up that can do it, and then targeting these additional resources for the other cohorts of people that really genuinely need more.
Thank you, Jessica. Francesca?
Yeah, I mean, we've had a lot of disinvestment in public services for a number of years, and particularly in England. And so what we're seeing is at the moment, local authorities are verging on bankruptcy because of the amount of money they're spending on temporary accommodation. So I think it goes to Lydia's point actually around, so we're in England in particular, there's a real focus on kind of like crisis management of the homelessness system. And I totally get why, because we've got rising need, but it means that then that kind of wider, like long to medium term systemic approach around early intervention and rapid rehousing doesn't get looked at. We're seeing in Scotland, they've cut their affordable housing budget, which is also kind of playing into this. So it's not as bad as in England, but it is a risk. In Wales, they're on the verge of doing something quite different and radical in terms of legislation again, and are really pushing to kind of really change their whole system approach. It's really positive, and I'd say, it's keeping that like innovation, radical thinking going, and that culture shift, because it takes time. And when you see, when you hear from Finland, for example, around kind of what it took in terms of like their systemic change, it wasn't a quick fix, it wasn't overnight, and it takes time, and it needs constant like monitoring. And I know there's also risks there at the moment in terms of a change in government. And I think, but my final point is, and we've just had a new government last week in Westminster, so we have positive hopes and kind of thinking about kind of what could change. But it is that, government terms are cyclical, and actually what we're talking about here is often longer than that.
Thank you, Francesca. That is an important challenge as well in Spain. Well, I think I'm going to stop here with my questions. I'm going to give some space to read some of the questions of the audience, so that you can also answer to their inquiries, to their points of view. I think I'm going to do it in Spanish, as we have the translation, just to keep it more literal. En primer lugar, se pregunta, hay una persona que pregunta por la detección de los casos tempranos de sinhogarismo también, ¿no? Igual que en el caso de Gonzalo se había comentado previamente, cómo se identifican a las personas de manera temprana, y también pregunta cómo entre comillas, cómo se convence a las personas para participar en los programas de acompañamiento. I don't know if you want to go, Francesca or Jessica.
Sorry, can I just get clarity? The companionship, are you talking about shared housing, or are you talking about
I think
the program?
About I think the question was in two different ways. How do you do to identify these early cases?
Right, and then how do you get them to engage, right?
Yeah, how to
Case management.
In case management. Thank you. Okay, perfect. Yeah, so engagement with services can always be challenging. I think people want to have as we're going back to the autonomy, right? They want to have the ability to say no, which at least in our states, people have the right to say no. We actually find that the most impactful time period of engagement is before they're housed. So we make sure that whoever the service provider, so the case manager, that's going to be working with that client actually engages with them while they are still in whatever kind of homeless crisis they're in. So whether they're in shelter, if they're unsheltered, whatever that may be, and you're building the relationship because that person is ideally helping them find housing as well. So the client is seeing the benefit of that person before they're housed, and we have found that ends up having a more successful kind of engagement and relationship while they're in housing.
Thank you, Jessica. I don't know if Francesca, you want to comment also on this?
I'd just say a very small comment. We did some work which is called 75 Ways to Prevent Homelessness, and I can send that. It is in English though, I'm sorry. One of the things we picked up is some examples where people don't talk about homelessness. So in a GP setting, they talk about financial inclusion, or other services are trained to kind of spot signs, and that helps in terms of kind of advice and engagement at a much earlier stage. So there isn't the stigma attached to homelessness either, and it is about kind of supporting someone at a much earlier stage in the process before they're at risk of losing their home.
Thank you, Francesca. I was going to go with another question. If you want to comment, Lydia, you can also do it. Or okay, so I'm gonna read another question. Someone's saying, a la hora de hacer el realojamiento rápido, ¿cómo se enfoca la intervención con personas que puedan tener problemas mentales o problemas de uso de drogas o de drogadicción? I don't know if you got the translation right, but in the event of rapid rehousing, how do you work with people who has some mental issues or addiction problems as well? I don't know if, I mean, you can go if there is anyone who wants to go with this question.
I think this touches on the question of population. What is the population that you're trying to serve with rapid rehousing? And if that person has needs that are more complex that can be served with rapid rehousing, maybe they need a different type of intervention, whether that's housing first or some other type of program. I think we have to be very clear on what is the population we're trying to serve, what is the population that's best served by rapid rehousing, and being very clear about that and being very faithful to that. Because we've all seen people put into programs that aren't the right fit for them, and that causes more harm to them, makes them less likely to engage in services and housing in the future because that trust has been further broken, and they don't get the housing outcomes, the health outcomes, the outcomes that we want for them and that they want for themselves. So I think that's where I would start in thinking through that. Is this the right fit for this particular person?
I would also say on this one, it's also around the point that was raised a few times earlier, which is around alliances and partnerships. So we do a lot of work. So via some of we run services for around 10,000 people a year. Wouldn't necessarily call them rapid rehousing, but we are trying to help people access housing. And actually that's around a holistic approach to them as an individual. And so that's about us forming relationships in the areas we work in with other services, whether that's referral into mental health, or kind of making sure that there is that support. But I also recognise there's challenges. I know that we have it where people are turned away or cannot access that, and I think we have high thresholds at the moment in the UK in terms of accessing mental health services, and I'm assuming it's probably similar elsewhere. So it is thinking around kind of how to do those partnerships to the best you possibly can.
Thank you also, Francesca. I'm gonna make a question now for Gonzalo. I think if you, Gonzalo, are here, there is a question that is kind of directed to you, I think. I'm gonna read it. una persona pregunta, pensando en los próximos años en España, ¿qué opciones de financiación se prevé que haya para este tipo de proyectos? ¿Es posible darles continuidad?
Menos mal que he pedido que las preguntas fueran fáciles. La continuidad de estos proyectos depende fundamentalmente de nuestra capacidad de convertirlos en política pública. Al menos en el contexto español. La capacidad que tengamos de darle continuidad a estos proyectos tiene que ver con que las administraciones entiendan que estos proyectos no solo dan mejores resultados, que es lo que parece que están indicando las evaluaciones, sino que además a largo plazo, incluso aunque el coste plaza no salga matemáticamente menor al año, la idea de que las personas salgan del sistema en el medio y en el largo plazo es realmente eficiente económicamente. Por lo tanto, ¿pueden continuar estos proyectos? Sí, de hecho estamos trabajando con varias administraciones para que estos proyectos continúen y si no continúan inmediatamente después de que terminen estos proyectos de innovación, pues se conviertan en política pública a lo largo de los próximos años. Pero aquí las entidades del tercer sector, y en este caso HOGAR y Vivienda, lo que podemos hacer es, y lo estamos haciendo de hecho, es poner a disposición de todas las administraciones. Si aquí hay administraciones que no han participado de los proyectos y están interesadas, por favor que se pongan en contacto con nosotros y nosotras. Estaremos encantados de acompañarlas, pero eso es la continuidad de los proyectos pasa a día de hoy por ser capaces de convertir esto en una política pública más. Como decía antes, esto no tiene que ser una anécdota que se queda en un cajón, en un informe muy bueno. Esto se puede modelizar y de hecho lo estamos haciendo y se tiene que convertir en una herramienta a disposición no solo de HOGAR y de Provivienda, sino de sino de cualquier actor que quiera poner.
Muchas gracias, Gonzalo. Hay algunas preguntas más, pero bueno, para respetar los tiempos voy a lanzar una última pregunta, en este caso más dirigida a Jessica, Lidia y Francesca. Y tras esta pregunta yo creo que tendremos que cerrar, pero bueno, quedan recogidas las preguntas y quizás podamos encontrar el espacio para darle respuesta también. Una pregunta que entraba tiene que ver con la evaluación. Habéis comentado que hay evaluaciones de estrategias de rapid rehousing y preguntan si podríais dar alguna referencia o si se han realizado alguna evaluación de carácter experimental con grupo de control. Eso, si podéis aportar alguna referencia o tenéis alguna evaluación en vuestros contextos identificada.
So from the United States, there's only one randomized controlled trial, which is the sort of highest level of research standards that you can get. So there's just one RCT out of Texas, I believe. And then there have been a variety of program evaluations where people are followed up at 6 months, 12 months, 18 months, 24 months. I don't think any go beyond 2 years. And so there's still a lot of assessment and evaluation needed for is rapid rehousing successful over the long term of keeping people stably housed. But there's kind of an inherent challenge of evaluating rapid rehousing programs because people are intended to move on into stability and not necessarily have that case management support. So it becomes very difficult to follow up with people. They might be doing great. They've just left that particular accommodation and moved on into their own accommodation. And so that kind of evaluation can be challenging. I'm really happy to follow up and send a series of resources to those evaluations if you want to share it in kind of the follow-up to this webinar. There's an organization called Apt Associates that did a pretty extensive evaluation of the 2008 sort of version of rapid rehousing in the United States. So I can share all of those as a follow-up.
Thank you, Lydia. Yeah, we will appreciate it. And Francesca, you want to comment on the UK context?
I would say we don't have enough evaluations on rapid rehousing. It's a real area of lacking. So we have evaluations on housing first, but not very many in this space at all. Mentioned we're doing an RCT, but it's not published yet. It probably will be in about a year. But yeah, definitely, what I thought has been brilliant about the HOGAR programme is the evaluation that's gone alongside it. It's really important.
Well, thank you very much. I think with this last question we can end the panel. Well, I just would like to thank you very much, Jessica, Francesca, and Lydia, for your interventions, and also you, Gonzalo. Vanessa, if you want to close the webinar.
Muchísimas gracias. Reiterar a las personas panelistas que además hacía mucho tiempo que alguna de ellas no las veía y ha sido un placer reencontrarnos. Y bueno, por no quitar más tiempo, efectivamente se han ido haciendo la recapitulación de cada uno de los paneles, de las diferentes preguntas, con lo cual yo solo destacaría que aunque en contextos muy diferentes, nuestras hipótesis, como decía Gonzalo, de partida han vuelto a dar el resultado esperado, y es que compartimos, aunque tengamos perfiles diferentes, evidencias diferentes, financiaciones diferentes, compartimos muchas de los retos, y el principal es transformar esos sistemas para que consigamos dar las mejores respuestas y más adecuadas a las personas en situación de sinhogarismo. Con lo cual, muchísimas gracias de nuevo. Os recordamos que los 2 webinars estarán disponibles, la grabación, en la Escuela Housing. La Escuela Housing, para nuestras invitadas extranjeras, en algún momento conseguiremos que vaya evolucionando la cuestión lingüística y poner a disposición de más personas los contenidos, pero de momento pues lo tendremos subidas estas grabaciones allí. Y ya os adelantamos, como al inicio, que dentro de poquito pues esperamos poder invitaros también al siguiente webinar que está dentro del marco de estos bloques que hemos estado trabajando en los proyectos, que estará basado en cuestiones de desinstitucionalización, que también es un tema importante y que creo que a nivel internacional también se están compartiendo muchos retos. Sin más, gracias a todas las personas que habéis estado conectadas todo el tiempo, y esperamos que realmente haya sido de utilidad. Como decía Gonzalo, aquí estamos también para lo que podáis necesitar y todo lo que podamos compartir. Muchísimas gracias. Buena tarde, buen día y hasta otra.